apical movement. So when you breathe in, there's apical elevation and apical depression. There's a functional biomechanical movement of the rib cage and thorax with breathing in and out. We've also got basal postural movement. So as we breathe in, the rib cage lifts and flares. So it lifts and flares out. And as we come and breathe out, it drops and flares in. So basal postural movement. And we can think of that as being either anterior movement in the anterior costal movement or posterolateral basal movement. We can sort of subgroup that into, look at, is this bit right or is that bit right as well? So we can subgroup that into two portions. And then we've also got the abdominal diaphragmatic. As you breathe in, the diaphragm contracts and pulls down and sucks air into your lungs. Okay, as you breathe in, the diaphragm comes down, it's going to compress visceral contents. Now, one of two things has happened. They're a fixed volume. Okay, they're not like sponges. There's not air in there that you can squeeze out. Okay, so when your diaphragm goes down, you've got to displace visceral contents. So something has to move if you're doing a diaphragmatic breathing pattern. You need to let your abdominal wall adapt to your diaphragm or your pelvic floor. You need to let go of your pelvic floor. Which one do you think is preferable? Don't let go of the pelvic floor. Okay, let the abdominal wall move. So what you should see is the diaphragm descends, the abdominal wall should move out. In, and as you breathe out, make it as you breathe in. Okay, the diaphragm comes down, and if you're doing diaphragmatic breathing strategies, there'll be a bit of that abdominal diaphragm down, the abdominal relaxing a bit, move in and out. Now, so long as all three of those are available to you, you can mix them up a little bit. You can emphasise more one than the other in various functional demands. Lots of different alternative therapies emphasise, and we'll try to prioritise one of these processes over the others. We see the Tai Chi process and Tai Chi and yoga, emphasising more of the abdominal breathing strategies. We see Pilates and the Alexander technique, emphasising more the basal, the costal. Okay. I have no problem with any particular therapeutic approach trying to emphasise one over the others, so long as not eliminating any of the others. You know, if you try to stop one and only move another, in function, that is not good function. In function, you can, so long as all three are available to you and present, and if you want to emphasise one a little bit more than the others, no, I have no problem with that. But trying to stop one in function while you move, while you emphasise another one to be dominant all the time, okay, I don't think is good. Having said that, we're going to do some tests where we do stop some and move another. Look at your ability to do that. Because your ability to stop one and move another, okay, is a motor control challenge. And we know that in certain problems, okay, people lose some of these functions. So people with respiratory disease, they have excessive apical and often lose the diaphragmatic. So, you know, it might be an idea to see if you can stop the excessive apical. For people with neck pain, they use guarding strategies. So they've also got excessive apical. Okay, but they've got excessive apical up, but they've got no apical down. Different. People with respiratory disease use apical up and down to compensate for lack of air entry somewhere else. But people with neck and upper thoracic problems split the upper apical components, but it comes up and stays up, and they don't come down. So we're going to test, can you hold the apical component down and breathe in and not let it lift? For people with upper thoracic and upper rib problems, particularly rib 1, rib 2, and up to rib 4. Can you prevent apical elevation while you breathe in? Because apical elevation is normal when you breathe in, but can you stop that if it's part of this function? Is a test. That's going to be the first test we're going to do. Okay. So we're going to be looking at tests. Can you emphasise a component that's excessive? We see in people with mid-thoracic, low thoracic, and upper lumbar symptoms, they lose the basal because they split. They're guarding their back pain, or they're guarding the rib cage by locking the rib cage down and don't let it move. So we're going to see if those people can get it up and keep it up. So what normally happens when you breathe in, it goes up. When you breathe out, it comes down. these people are down all the time. So one of the things we're going to do is, can you get the basal expansion up? Hold it up. And don't let it drop down when you breathe half the air out. The benchmark is half the air out while you maintain this abnormally elevated basal rib cage. Okay, so they're tests of recruitment control. They're tests of your central nervous system to be able to change options when it needs to. Because what we find in people with low thoracic, upper lumbar, and lower rib cage problems is that those ribs are down, okay, and they're down all the time. And they're sometimes using more abdominal or more apical because this isn't moving enough. And we want to see if they have the ability to get it up and keep it up and maintain control of that. So when they breathe out, it just doesn't take over and lock down again. So that's sort of where we're going to go with some of these tests. So I'll just go through them